All right, my dears, let's discuss the syllabus, then we'll go through project assignments, okay? So here's our syllabus: course description: providing nursing care that leads to quality outcomes and is protective of patient safety. It's essential to the nursing practice. A major initiative within the healthcare industry is to improve patient safety, reduce errors that impact patient outcomes. The course is going to focus on the processes and practices of quality assessment and continuous quality improvement in healthcare. Students are going to examine a variety of health indicators that reflect nursing accountability. You'll examine the issue of patient safety, risk appraisal, medication error reduction. They will create a safe model or quality improvement initiative for a sample group of clients or nursing personnel. And that's one of the projects. And it's a really cool project, okay? It's going to help boost in your career. Because if you could present this to your manager or to your organization, they're going to be like, wow, you must be a BSN with awesome education. It's really cool, and I'm really glad I learned about it. And I really didn't understand it in my BSN. QI was just coming down the gauntlet then. So now, as you move on, you'll always get QI teaching, which is great because you'll get it threefold. All right, so here are the course objectives. Recognize the client as the source of control and full partner in providing compassionate and coordinated care based on respect for individual preference, values, and needs. Define the term quality as it applies to healthcare and nursing care structure, process, and outcomes. Explain and apply the processes and methods used in continuous quality improvement to a nursing care issue. Function effectively within nursing and healthcare teams, fostering open communication, mutual respect, and shared decision-making to achieve patient quality care. Identify healthcare risks to client safety and develop plans to mitigate or reduce safety risk. Analyze nurse-sensitive client outcomes and describe strategies to achieve optimal outcomes in the clinical setting, and describe how information technology and evidence-based practice can impact quality and safety in nursing. So I know that sounds like a mouthful, but we'll get through each one as the quarter progresses. So your book is Sherwood and Barnister. Let me show you. I have an ebook. Let's see if I can get you guys a pretty, this is here, right here. That's what it looks like. You can use any edition. Let me know if you guys got a separate edition so I can help you match up the chapters. There shouldn't be too many changes, and if there are, I'll help you figure them out in your reading, because I do understand that books can be expensive and it is a little cheaper to get an earlier edition. So just let me know. It's totally fine if you need to use an earlier edition. So instructional methods, lecture, and discussion. So lecture, you're going to see it on the wall every week. I have noticed that in some classes people really don't listen to lecture, and some do. I think it's helpful, especially to clarify topics. And hopefully I'll try to make the lectures less dry. I know today it's kind of dry because we're just going through stuff, but I try to mix it up. So just remember the lecture is an integral component of your learning. Reading, obviously, that's going to help clarify any questions. Writing, so a lot of these assignments are writing, homework assignments and projects. That's how we're learning, okay? And it's full distance education. American Disabilities Act, please read the policy on that in our campus catalog. So classroom policy, we've talked about this. Respectful learning work environment. You guys are adult learners. You're not here to be disciplined. You know, when I went to undergraduate when I was 18, and half the time my nursing instructors were my babysitters too, because you're just growing up still. But that's not happening here. You guys are adults. We just need to be respectful of each other. Be respectful of me. And I'll be respectful of you and your needs, and we will try and work together. Please abide by the academic policies related to attendance, behavior, and professional conduct. Don't lie to me. Don't write in the middle of the quarter when you haven't been involved at all, asking to make up stuff in the end. But if you're upfront with me about your needs, I'm flexible, and I will work with you. But I will stop working with somebody if it's too late or if they've been disrespectful in the past. So I've never had a problem. Everyone's been really great. And I get it. You guys work, you have children, you have family, there's all this stuff that goes on. So just try and keep me apprised. Dr. Smith-Clay and I are, we really just want you all to succeed. I've never had problems with behavior or professional conduct before. I think that's on there. Obviously, it's on there for a reason because there could be a problem. But attendance is usually the trickiest part. I think what happens is people just get nervous about approaching me. Don't worry about it. I'm here to help you succeed. I want you all to graduate and move on and be successful nurses. All right, so let's talk about method components for how I'm going to grade you. So we have forum discussions. There's 2 each week. They're 10 points each. So that equals 100 points. And I have 200. My bad. So I will fix that. Evaluate website paper. Okay, so that's a project we'll talk about in a minute. Short response paper and quality improvement poster project. These are all really important to quality improvement, and I try to switch it up a little so it's not too dry, but that's how you're going to get graded. Here's our grade point scale. All right, so here are nurse core values. We don't have a clinical. Yay! All right, so listen, you guys have to trigger. So trigger is meaning a meaningful contribution into class. So posting on a discussion forum, turning something in, attempting a quiz, which we don't have, or responding to a forum. So the main way you're going to trigger in this class is with your forums, and make sure you do it on time. If you miss 2 Thursdays in a row, even if you come late, they technically could, what do you call it, withdraw you from your course. So just make sure you're triggering, okay? And if there's a problem, like, Denise, listen, I got to trigger on Thursday, but my initial forum discussion is not going to be perfected until Friday morning. A lot of times I'll work with you, but you have to email me ahead of time, and it's not going to be an every time thing. And there's no after the fact. So don't post something that's terrible and then say, well, that wasn't going to be my official post. I was going to go back and fix it. You have to tell me ahead of time. And it has to be done within 24 hours of when it was initially supposed to be posted. Because, you know, this course moves so quickly, there can't be any backseas on that. All right, makeup policy, you have to talk to me about everything. The earlier you get to me about making stuff up, the more flexible I'm going to be. Academic integrity. This could be its own lecture. I definitely see a lot of plagiarizing. Some of it is unintentional. I would say most of it's unintentional. There's lots and lots of resources I posted on figuring out how to avoid plagiarism. Making sure you're thoughtfully citing things is important. So if you make a claim on your paper that says errors are an expensive cost to healthcare, you need to cite that phrase, okay? You've heard it from somewhere. It was not your own original thought. Make sure a lot of times you're going to see citations in a lot of your work, and don't get nervous by that. And I will show you examples of my work. You don't have to obviously write at my level, but if you look and read articles, you're going to see there's a lot of citations because most things are being supported by evidence, okay? When things are deliberate, you're going to get a significant penalty. And there are deliberate where people copy and paste and work their way and change the font and all that. And I can see when that happens because I put everything through a special internet source that helps me look to see if people are plagiarizing. I know sometimes it's accidental, but it's up to my discretion. And I have given people zeros and they've ended up failing the class, and I don't want that for you guys. So the Learn Center is really good at helping you with that. They will grade every paper for you before turning it into me. So I would highly suggest using them. And the librarians help a lot with APA. Okay, so here's the information on the Learning Center. It's also on the front board, and the library stuff is on there as well. Here's information on plagiarism. All right, so let's go through the course syllabus. So first week, okay, the driving force of quality improvement in healthcare, policy implications in healthcare and patient-centered care and safety. We're reading chapters 1, 2, 4, and 8. And the only assignments due are forms 1 and 2. Week 2, you're going to have your QI poster project due. And this is a really cool project, and we'll talk about it right now. So let me get here. All right, QI poster project. Okay, so the first project is not a paper. It's actually going to be a poster board presentation. And I think this is a really cool way for you guys to kind of practice getting in the QI swing of things. So whenever you've gone to conferences or you see on your hospital wall poster board presentations, this is going to be a example of that. So you're going to collaborate with your staff and just ask, what's a problem on your unit? So I'm going to use an example. For those of you who work in mother baby. Okay, I'm trying to think of what a possible problem can be. How about post-cesarean pain? Okay, now listen, it's not your job to conduct a huge research. It's one problem and you're going to do one small change. Okay, this is a quality improvement project. So maybe you're finding that it's really hard for patients to report their pain because they don't get asked enough about their pain. So you're going to choose a quality improvement model. A lot of people use the PDSA, and you're going to read about the different models. And I will also post a website. Oh, I did, on the different types of quality improvement models. I actually did. PDSA is the easiest one. You're going to use a quality improvement model project to come up with a solution. So you're going to go through some literature and find out what are some quality improvement solutions for your problem. And you're going to create a poster board presentation of the problem, okay? And you're going to talk about, so what you're going to do is identify a clinical problem. You're going to identify a QI model. You're going to formulate a solution that's evidence-based, and you need to show me the evidence that you use. So that's where your references come in. And you're going to include a method to evaluate the outcome. So I'm going to show you guys some examples, okay? And if you follow these examples, you're going to get an A. I'm going to say that again. If you follow these examples, you're going to get an A. All right, reducing hemolysis in the emergency department. So I don't know about any of you guys who work and draw your own blood. So when I worked in the ICU, you draw your own blood, and also in the emergency room. Hemolysis is when the blood sample clots before it can get to the lab, and so it's going to skew your results. So, introduction, background, problem. Hemolyzed blood samples in the emergency room cause a delay in ED diagnosis, care, and treatment. Historically, RNs drew the blood samples while inserting the peripheral IV rather than drawing blood samples from a separate venipuncture. Why? Because you don't want to stick your patient twice. I get that. So the aim of this process improvement project is to decrease the hemolysis rate to less than or equal to the College of American Pathologists benchmark, which is 2%. What's a benchmark? That's the goal for all of us to reach, okay? Solution, educate emergency department RNs on the 2-stick protocol and 1-stick exemption for critically ill injured patients. 1-stick exemption evidence-based practice guidelines to reduce hemolysis as below. Here are the methods to evaluate, okay? And that's all in your book on evaluation method. And then the implications, here's the references, and here is the model that they use, the PDSA, okay? All right, so that is due week 2. Now, I'm going to show you guys something. When things are due week 2, so week 2 starts April 6th, okay? That means you have the Sunday to turn it in, so it'll be due April 9th. But I'm actually putting the due date as April 16th, okay? And I'll show you. You go down to week 2 where it's due. It says here, due April 16th, okay? So if you have any concerns, you can always ask me. All right, let's go back up to the next thing. Evaluating a healthcare website. Okay, why is that so important? So one of the QSEN competencies is to be able to integrate evidence-based practice into clinical practice in order to deliver optimal care. So we use the internet resources for our patients. I don't know about you, and I know our patients use internet resources, okay? So it's really important that we provide our patients with reliable information. So you need to be able to critique a healthcare website, especially if someone comes in and says, okay, so I'm following the diet by Diabetes Sisters. Well, who are the Diabetes Sisters? Is their diet ADA approved? Is it supported by evidence? It's your job as a nurse to make sure that your patients are using the right information. So you're going to pick any type of healthcare website. Obviously, anyone. You could do Medscape, you could do one that's grassroots, you can do an official one, whatever you want to do, okay? If you look on page 178, there's definitely a lot of information on there in the text. And you're going to answer these questions. Now, This one is going to be a lot more laid back. I know it says APA format and grammatically correct. And for those who are listening to the lecture will hear that I say this can be very informal. Okay, it could be a list. You need to answer the question thoroughly, but it doesn't need to be this perfect, pretty APA paper. Okay. And last but not least, a short response paper. Okay. If you go to this website, while that's loading. Okay, you're going to listen to this podcast and you're going to respond 2 length page maximum. And you're going to respond with the following questions. How can you as a nurse leader contribute to culture of excellence in patient care? Provide 1 or 2 examples of change that you will implement based on the information obtained in this course. You're going to use some research, so make sure you get some research articles. And you're going to talk about your care as a nurse leader, examples of change, and reflection of change. Okay, this is still loading. If anybody has trouble with it, I will find a different way to get on there. Okay, and that is due week 5. Okay. All right, so I think we've gone over everything. So the next time I see you will be during the lecture.